Welcome everyone to our first episode of the Ask a Doc show. This one is featuring Dr. John Pitts. I'm your host, Dr. Jason Deitch. I want to welcome all of you to our brand new program, which is really designed to help you. All of you following the Centeno-Schultz Facebook page, all of you that have been watching what's going on, reading Dr. Centeno's blog, watching all the different doctors at Centeno-Schultz, constantly pouring their hearts and minds out to let you know that help is available. If you are looking to reduce your risk and hopefully avoid addictive drugs and dangerous surgery, then you are the right place. This is the right show. And Dr. John Pitts, you are a star at the Centeno-Schultz Clinic. Everybody knows it. Many of you, I'm sure people watching, are current and past clients of yours. Others are going to be potential new clients of yours. Let me say thanks for taking on and being a guest on this first program. How you doing today?
I'm good. Thanks for having me.
Right on. This is really exciting. I know there's a lot of demand of people asking questions. They want to know, can you help me? Is this the right technology? Are these the right services? What about something another doctor told me? Or where do I even begin? So today we're going to start our topic with the rotator cuff, also known as the shoulder. And let me kick it over to you, Dr. Pitts. What do people need to understand sort of about the normal mechanics of the rotator cuff and some of the more common injuries that you're finding a lot of people are suffering from?
Sure. So the rotator cuff is actually a group of 4 different muscles that help to stabilize the shoulder ball, the humerus head, into the socket, the glenoid. And so these 4 muscles, you have one on top. The most popular one is the supraspinatus. You have 2 in the back, the main one, the infraspinatus, and the teres minor is a secondary one. And there's one big one in the front called the subscapularis. So all these muscles work together along with other muscles to help to move your shoulder normally, keep it in that socket, because if that doesn't happen and the shoulder moves out of socket, that's where you get wear and tear, stress, injuries. Also, of course, these things can be injured from a traumatic injury, from a fall, getting hit on the shoulder, car accident, just overuse if the mechanics of the shoulder aren't great, or from working out, lifting, get into abnormal or stressful positions. These can injure those rotator cuff tendons. So the tendon attaches the muscle to the bone, and this is typically where the injuries occur that don't heal well on their own. If they're just injuries in the muscle, that typically heals well because it gets great blood supply. But the edges of the muscle where it attaches to the bone, the tendons, they don't get good blood supply. And so when they get injured, they have some local healing cells available. But if the injury is too severe, then those local healing cells can't keep up with the damage, and maybe some help is needed. So those are the basics of the rotator cuff, how it might be injured. The supraspinatus is the most common type of injury, but also the other ones can be injured. And so you really have to focus on finding out what the problem is, why it occurred. So what we do is going to take a full evaluation, exam, history, ultrasound, possibly get an MRI, and figure out what the problem is. And if it's a problem that we can fix, we'll give you a plan, mostly trying to treat these areas by getting your body heal itself via injections, rather than just masking pain with drugs, injecting it with steroids that can be harmful, or having to do surgery. Now, if we do see something that does require surgery or that we can't help, we'll tell you that too. So the first thing we look for are problems we can't treat to make sure that we send you to the right way. But if we can treat it, we'll let you know, and majority of the time we can.
Shoulder is such a common injury, as you described, sort of the anatomy of it. It's one of the few joints that really is, primarily held in place by muscles and, ligaments and tendons and so on. It doesn't have, all the protection that many of the other joints do. So it's a very common area to be injured. What are some of the common symptoms that people feel that if they're feeling those things, they should not just, take another, painkiller and, kick the can down the road? I'm sure it'll be fine. I've heard it said that the 6 most dangerous words you could possibly say are, I hoped it would go away. So what are some of those things? I know sometimes people feel just dull ache, maybe from sleeping on their shoulder. Sometimes there's, sharp shooting pain, whether it's local. Sometimes it goes down the arm. Sometimes it goes up the neck. What are you finding to be, some of those, flags or warning signs that if somebody's feeling, they should probably pick up the phone and give you a call?
No, absolutely. So yeah, certainly people are going to feel pain. So pain anywhere in the shoulder. So it can be in the front, it can be on the top, it can be down the side and down the arm, it can be radiating down the front of the arm. It can be a dull, achy sensation, sharp shooting. It can be worse when you get into certain positions, like raising your arm overhead is a common one, reaching backwards, reaching behind you. You may start to notice some sharp shooting pains with that. You can get a dull ache when you lay on it at nighttime. And the reason is when the shoulder's normal, if you can press the blood supply, it's no big deal. But when the shoulder's abnormal and trying to heal from an injury, if you compress that blood supply lying on it, it's going to hurt more. Certain positions are going to put the rotator cuff or other structures in the shoulder under stress. And so those can be painful. When you're lifting heavy things, that can be painful. If you start losing range of motion, which is a big one, so you can't lift your arm all the way up, you can't rotate it out like you could, it's hard to put on your shirt and clothes. Those are other signs that you're having some shoulder problems and you need to get that looked at as soon as possible.
If you're watching and you've got questions, whether it's your shoulder, whether it's your spouse or partner or friend or family member or coworker's shoulder, whoever's complaining to you probably about how much their shoulder hurts, now's the time you get to ask Dr. John Pitts directly. We are live here on Facebook. If you've got questions, we've got solutions, and that's why we're doing this program. So, Dr. Pitts, let's talk kind of the philosophy. I've heard that the word pain should be understood to mean pay attention inside now. PAIN. It's your body's way of saying to pay attention to what's going on inside. My question for you is, for those people watching, how should they think about pain? Is this one of those things that, there's some that think that pain is that thing you should just kill with painkillers, right? Just get rid of the pain. Just shut it up in any way possible. Kind of like if the fire alarm's going off in your house, just cut the wires, take the battery out of the, smoke alarm, whatever it is to get the symptom or signal away. And then there's others that think of pain actually as an intelligent way of the body trying to say, hey, something's not right here. I need your help. What's your philosophy, and what should people do? Is it the first sign of pain they run in to see you, or should they be looking for patterns where it's chronic and happening over and over again, or how do they best protect themselves? So nobody wants to be a hypochondriac, but yet nobody wants to let something small become something large when they could have handled it when it was a smaller issue and yet didn't know better, waited till it was a much bigger problem, which usually means more, bigger procedure, longer healing time, more cost, all that stuff. How should people think about it?
Sure. So pain is your body's way of telling you, hey, something's not right, something's getting injured. We need to do something about this. And so, obviously, if you haven't had a traumatic injury and you're feeling some pain, try to identify what activities or movements are causing it and try to avoid that. If these are activities or movements that you can avoid or that you have to do, then you certainly want to get those things checked out to figure out what's going on. But your body is smarter than anybody else, so it's going to tell you when you're not doing something that you should be. And so if you're smart, you'll say, hey, man, that hurts. I better not do that. Rest it. Try some things to help it out, or go see my doctor to figure out what's going on so they can give me some direction. Versus, oh yeah, it hurts. Well, I'm just going to push through it because I'm just going to keep going because I just got to keep going and let it get worse and worse. So that's typically not the solution. And then we all got to distinguish pain from soreness. So soreness after working out, doing some new activities, muscle aches and tightness, those are typically less concerning unless they're persistent for several days or weeks and inhibiting activity. So most people can understand soreness versus pain. Some people can't. So some people aren't as in tune with their bodies, so you have to really pay attention. But if you're at the point where it's affecting your life, affecting your sleep, affecting your activities, affecting your range of motion, putting on your clothes, sports, things you want to do, you definitely want to have that checked out. And because if you don't and you keep pushing through pain, you're likely to make whatever injury worse. And then, like you said, the worse something gets, the more involved the treatment may be. And so, for us doctors, this is how we treat ourselves since we know how this stuff works. Oh, I got a little bit of pain. Oh, that just seems like some muscle soreness. Let me just alter my activities. Or, oh, you know what? I recognize my form was bad when I was working out. I'm going to address that. If there's anything else, you're like, oh boy, let me just get that treated now because I know if I get my partner inject me prolotherapy or PRP, I'm not going to have any downtime. I can keep working out. I can stay active, and that problem will go away pretty quickly. Versus if you wait until the stews and brews, then maybe I can still do the same treatment, but I got more downtime or more recovery, or maybe I got to upgrade the stem cells, or worst case scenario, things just get so bad where I'm gonna need surgery, and we definitely don't want to get to that point. So that's how we treat things and handle things ourselves. And for us, I never take pain medicine. I can't remember the last time I ever even took a Tylenol, or Advil, or ibuprofen, any of that stuff, because I want to know if something hurts to determine. Now, obviously, there's some things that hurt a lot, and you might take that temporarily to get some pain down before you get to the solution. But those are not long-term fixes or solution. They're just telling your body, hey, things don't hurt. A lot of those medicines, like the anti-inflammatory drugs, have side effects that can actually inhibit your healing or make the injury worse. Or if you're feeling better and you still have the injury and you keep doing your activity, you're just going to keep injuring it because now your body's not warning you, hey, you need to back off of this activity. And then the second thing is steroid injections. You couldn't pay me enough money to get a steroid injection because I know that can inhibit tissue healing directly. It can cause more tendon and ligament and cartilage damage. So I wouldn't do that. And you definitely couldn't pay me to have surgery unless I absolutely needed it. So that's always the nuclear option, the last resort option. So for us, our focus is trying to get a person better so they heal these things and thus the pain goes away. Versus, hey, let's just get the pain away and see what happens.
You know, you got your fan club is joining us here today. So let me just share a few things here. We got Brett Lux who's saying, watching this live on the stair stepper. Dr. Pitts, thank you for getting me back into the gym. So kudos to you. That's awesome.
That's great multitasking, Brett.
Yeah, exactly right. That's called doing something right and learning for your body and your mind. So Brett's 4 weeks out from his PICL, as he said. And here you go. You got Pitts is one of the best around, period, from our good friend, Dr. Evan Katz, phenomenal chiropractor in the Boulder area. So Dr. Katz, thanks for joining us as well. You are, I mean, I keep, you know, whenever I'm around and I keep hearing these things, people just not only love you, but love the results that they get from you. You touched on it. Before we end today's show, I just want people to get a sense for, you know, they go, it hurts. What are their options? Like if your family member had a shoulder that hurt and they were just, you know, thinking, well, what options do I have? You know, I can just go down to local drugstore, buy some over-the-counter stuff. I can go to my traditional medical doctor who's probably going to either write me some sort of script or if it's bad enough, you know, some sort of imaging, probably going to want to send me to a surgeon. Help talk through what's the, I'll say not normal because it's not really normal to want to get drugs that make you worse like the steroid injections, but what's the common approach, maybe even the mistakenly common approach that people take, and what's the better alternative by working with you and handling these issues naturally?
Yeah, absolutely. So first, every single doctor, including us, you know, we're trained to figure out what the problem is. The problem is just in today's healthcare, a lot of doctors just don't have the time to put in to do that. And so luckily for us, we have the time to evaluate a person. So the very first step is let's get a history, let's examine you, let's ultrasound you and figure out what's going on. Because all shoulder pain isn't rotator cuff. It can be coming from the neck, it can be coming from nerves, it can be coming from other structures. So we have to figure out precisely what's going on, how severe it is, and what the patient's goals are. So all those things are important to come up with a diagnosis and then the plan. And then as far as the plan side, the reason I got into more regenerative medicine is because I could do all those same things in traditional medicine if I had a little extra time, but then my solutions would only be, well, okay, I know what's going on. You can try physical therapy, chiropractic, acupuncture modalities, and all those things are great. Sometimes they take care of it. That's perfect. When that doesn't work or you can't do those things, then only option I have is a steroid injection that helps the pain temporarily, plus or minus, but then it can cause damage. So I can't keep doing that. And then after that, I'm out of options. Only other thing I have to do is send you to a surgeon, which you might not be a candidate for, or you may be a candidate for, but it's not really appropriate because we got better things to do. And so now in the field that I do, I can actually treat those issues. So if it's a very minor problem, I might consider doing some prolotherapy. If there's a medium problem, PRP works well. If there's a more severe problem, bone marrow concentrate with stem cells work well. And then there are also some subcategories of other treatments that we do that aren't as well advertised, like 10X or other procedures, hydrodissections, treating nerves. We have all these different tools in the tool belt to do whatever it takes to get the patient better, but still the focus on treating the underlying problem, letting the patient heal themselves, and not just masking things with drugs or send them for inappropriate surgeries. We will send them for surgery when necessary, but that should only be a small percentage of the time, not the majority. So those are the differences. Sorry about
That's not our closing music yet. Stay with us. We got a couple of questions left, and we'll close for today. Last call for questions. So if you got questions, now's the time to ask. So, Dr. Pitts, I know you mentioned it briefly before. I'm watching the numbers. We had a bunch of people join us a little bit late. So if somebody's feeling some sort of pain, you'll see the phone number right in the description if you want to call. But if somebody were to reach out to you, one, they can have the choice to either work with you via telehealth as an initial get to know you consult, or if they're near the Boulder, Broomfield area, they can come in to see you live. I got that right, number one?
Absolutely.
All right. Number two, let's go through, I love what you said, and I hope everybody's really hearing it. I'm going to emphasize it because, the takeaway I heard was don't just mask the pain. That finding and correcting the cause of the problem is really the long-term way to address the issue. Makes perfect sense, right? As I said earlier, if you cut the wires to the alarm system because there's a fire going on, sure, the noise is going to go away and you won't hear that annoying symptom. But unless you address the fire, you're just delaying disaster. Is that how you see it? And if somebody comes to see you, I know you said it briefly earlier before, but I want those people who just joined us, describe the process. They either get on video with you or they come in. I know you guys do one of, if not the most comprehensive physical exam as part of your training, as part of what you do. Help people understand why they should basically either, get on the phone and get an appointment either for telehealth or to come on and see you if they're experiencing any of these symptoms.
Right, exactly. The difference between us is that we actually will take the time and have the skill set to examine, diagnose a multitude of problems and have a multitude of treatment options, ranging from everything conservative to aggressive and just trying to avoid drugs and surgery. So that's the most important takeaway is figure out what's going on, and that's what we're going to do. And then after that, if you live locally, we want to see you in person. That's best so we can do hands-on exam, ultrasound, look at the tissues, show you what's going on. If you live further away or you just can't make it in, a telehealth visit is a great place to start. So we can get some history. We can maybe see you through the tele and do a few kind of minor exam maneuvers. If you have MRI or X-ray, we can take a look at those and at least have a tentative idea if this is something that we can actually treat. Is it worthwhile for you to come in the office so we can get together a fuller plan? So those kind of the first steps. Usually people might try conservative things, rest, giving this some time, alternate activities first. But when those things don't help, that's when you come see us, and we can even direct you for how to direct you with your therapist or chiropractor or whoever you're working with to help these issues, and then give you all the different treatment options that are specific to your problem. So one thing, that a lot of people come in like, oh, I want to do PRP or I want to do prolotherapy. And it's like, when you go to, that's because people are used to seeing a practitioner, they have one tool. So they just try to fit that tool to whatever diagnosis they have. And for us, we got many tools. So we're trying to find the right tool for the appropriate diagnosis and help that patient with their specific goals. So everything is customized and tailored specifically to the patient.
I'm so glad you brought that up. It's one of the most common mistakes I find that people make when, doctor shopping. Is that people think well, my friend had this fill in the blank, whatever procedure, or, as you mentioned, PRP or bone. They think, well, my friend had it, it worked for them. Maybe it will work for me. But what I love so much about what you said, and I hope people are listening and learning, is that it has less to do with which specific technology. You don't go in and go, I want you to do this to my car. You go in and go, I want you to check out my car and figure out what needs to happen. And the key in finding a good auto shop is finding someone you can trust. It's not necessarily that they got the best, jacks, the best lifts, the best diagnostic tools, or the best, craftsman tools, whatever it is. It's not about the parts. It's first about making sure you got the right expert to help guide you to using the right tools and the right time and the right doses and so on. And so that's really very much, I think of it as sort of the Centeno-Schultz difference, that it's not about having one tool and finding all those people that can use your one tool, but it is about building trust. Again, why we're doing this show, so you can ask questions, you can really learn more about Dr. Pitts' philosophy. It's very different than the traditional, come on in, get your drugs, it's covered by your insurance. When it gets too bad, then we'll throw you to surgery. When it gets too bad, we'll throw more drugs. And that really is the typical pathway that most people unfortunately take when it comes to their orthopedic problems. And of course, this is different. Anything I said there you want to correct or update or?
No, I think the big thing is trust, because really we try to establish that trust because, we have to do a lot of education and re-education because a lot of people have been misled by just kind of what you find on Google and the traditional medical approach. So, that's the toughest part, is just establishing that trust. Once we have that trust, then, you're going to be in great hands because we're going to tell you if you're a good, fair, poor candidate, if this is not going to work for you, if you got great chances, lower chances. So we're going to take care of all that. We're going to tell you what tools we have and what are your particular options. And we're going to have the best regenerative tools in the whole world to take care of that. We're going to have the most experience, the most knowledge. So we do all that troubleshooting and little detail stuff for you. And then we just try to bring you up to speed so we can educate you and give you all the things you can do on your own, as far as therapy, chiropractic, diet, supplements, rehab, all those things. We're going to help guide you through the process. So it's a team approach where we do our part, you do your part. Your practitioners do their part. So it's a nice team approach to do everything to get you better. It's not just, I can do PRP, so I'm going to do PRP for everything, and you don't need to do anything else.
Fantastic. That's what it's all about. If you've got questions, now's the time to ask. We'll be doing this show weekly on Wednesdays, just like this. This is our first episode of the Ask a Doctor show. You can leave your questions even if you're watching the replay. Not all of you are watching live, so you can leave your questions down below. And I'm also going to ask, if you like the show, if this was of value to you, if you got something out of it, or you just want to say hi and show some love that we're out there trying to help as many people as we possibly can, go ahead, give us a like, give us a comment. Hey, maybe even share this with people whether they're suffering from rotator cuff injuries or should just watch it in case they eventually do. It's a really popular injury, whether it's because you're sleeping on your shoulder or whether you're using your arms in all the ways you're supposed to. And as we all age, things happen. And as Dr. Pitts said earlier, and it's one of the philosophies of the Centeno-Schultz Clinic, when you take care of small issues, they require small solutions. Small means faster healing time and lower prices. You don't need as big of a procedure. When you don't listen to your body and you wait and the pain gets worse and the problem gets worse, you're looking at longer healing time, and in most cases, it typically costs you more because you need more injections, more care, etc. So be smart, do the right thing. Thank you for joining us. This is the Ask the Doctor show. Thanks for your feedback down below. We'll be back next Wednesday. Leave your comments, leave your questions. Thanks for joining us. Until then, on behalf of Dr. John Pitts, I'm Dr. Jason Deitch. Thanks for watching. Thanks for enjoying the Ask a Doctor show. Stay well.
Thanks, everybody.
Thanks, John.